Hey folks, I've been had a request here to talk about this one from a few people that have gone through a broken neck or neck surgery recovery, especially if you've had it done posterior through the back to be able to get to your vertebrae. In my case, I had an accident where I broke C1 and C2, so they had to cut in the back there to put in some titanium rods and screws to fuse between C1 and C3. So, of course, you have to wear a neck brace for a couple months after that, probably at least, to just kind of keep everything stable. But during that time, what happens is your neck atrophies, even though, they want you to take that thing off sometimes. For the most part, you have it on a lot. So it's pretty much holding on the weight of your head. So you're, particularly in my case, my upper back muscles in between my shoulder blades really kind of got pretty weak. So what happened was then once you could remove the neck brace, you really start to have like fatigue and pain in the back of your shoulders and the back of your neck that it's just kind of hard to avoid. And then you try to get to the point where you're like, what can I do to relieve that some? So some tips and some things that I've done and noticed that helped me besides, taking ibuprofen and Tylenol, obviously, but that just kind of masks it for a while. And you really want to, talk to your doctor, your PT or whoever to make sure that it's okay to, do use some of these things. But for me, I found that, if I just taking a standard kind of one of these massages guns and using it on the back, kind of like on the sides of your muscles, really helps kind of loosen things up. And that works out pretty good. You just gotta be careful, especially when you get up closer to your head. You don't want to use this thing too close to your skull because it literally, these shake so much that they can vibrate the crystals in your ears around, and you could end up having vertigo, vestibular vertigo, which it can be fixed by with a process that they do where they kind of do manipulation on you to put the crystals back, but it's not something you want to have to experience if you can avoid that. So these, just be careful close to your head. But they definitely serve their purpose. And then some cases, like I will just use a regular heating pad. Like now, this is just a standard heating pad you can get anywhere. But that one I will just turn on and I'll put behind me on my chair and just let that thing sit and cook on the center of your back for 15 minutes or so to help loosen things up. That really helps a lot, especially in the evening after a long day of work or something like that. And you can usually control the different settings on them and get them kind of exactly what you want for heat and time and everything. So that works out pretty good. Then I've shown this one before on a video that I did, a short video I did about just stretching your neck and things like that and relaxing your neck. But this one is one where you can literally, like, you can turn it on and it's got an internal battery and that just kind of sits around your neck. You can kind of hook it on around your neck, and that one just kind of more focuses on the top of your spine and your neck muscles, which in my case, that's a lot of where my problem is because of where my injury was and the surgery. So that one, this one I tend to use a lot, but like I said, it's a battery, so you have to recharge that thing occasionally. And then there's a more advanced one that's this is a nice one. This one has like these rotating like massage balls in there and heat as well. You can add heat and everything to turn the heat on. And this one is kind of like a device. It's got a nice little pad. You pretty much just put this behind you wherever you want that, you need the relief, and just you can let that work. And that works pretty good because that's actually giving you like a little bit of a massage. And then of course I put it lower and kind of let that thing do its trick. But again, make sure you're cleared by your doctor and PT or whoever to let you, that's okay for you to use these things. And then I go now twice a month for a massage. Once I finished my PT, they highly recommended getting a massage, deep tissue massage. So I go two times a month and do deep tissue massage, and I have an awesome therapist. She's not afraid, she understood my injuries and everything, so she doesn't have a problem kind of getting in there and working my neck muscles and my back muscles. But that really helps kind of reset me after a couple weeks, because working, especially if you work on a computer or whatever you do, you get tight by the end of the day, no matter what, even if you do exercises to kind of help rotate and stretch your neck. And I have another video that kind of shows some tips and tricks for that kind of thing. But you really, you need that massage helps. And then with the massage, what was nice too is, I have an FSA, and some people have HSAs and stuff like that for healthcare savings accounts with their insurance, whatever. But what you could do is they don't cover massage for whatever reason. I don't understand. I mean, they do, if you want to get like, acupuncture and chiropractor, but acupuncture I'm going to probably try eventually. I've never tried that. I heard that's really good too for nerves. But chiropractic, I mean, my surgeon was like, yeah, those days are gone. You really should never go see a chiropractor again with the injuries and fusions I have. So that's kind of a bummer, but it's all right. I can work around it with some of this other stuff. But yeah, with the FSA anyway, since they wouldn't allow massage and it wouldn't cover that in there, I just contacted my primary care physician and told her, and she basically wrote a letter. You can send a letter to your FSA or your HSA that says, yeah, this is medically necessary. So then that letter just stays on file, and whenever you submit a claim, it just goes right to your right to that, and I can see that the letter is authorized, and there you go. You get your money back, which is really nice, because massage is not cheap, and but in this case, it is medically necessary. I mean, this thing really helps me out a lot. So in my case, a lot of problems that I have are as I start to get fatigued, especially after a long day or doing a lot of work where you're in your powers and your arms are kind of in front of you. Your weight's a little bit off center like that. It feels like like bugs are crawling around my kind of like my shoulder blades and stuff like that. So, and that's something that's I pretty much got that like day one after the surgery. So yeah, these kind of things help me. So I don't know, maybe you've got some tips that you can share with some of the other people that come to this channel. I mean, it's very helpful, and I know I watch the YouTube videos and I listen to people's tips and tricks as well, because I feel like there's, this is kind of a unique injury and surgery that us people are going through, and you need all the tips and advice you could get and support. So I really appreciate everybody that sends their messages, and if you have any questions for me or anything, or there's anything else I can help you with, please don't hesitate to reach out. And I hope some of these tips help you. They definitely help me, and we're in this together recovering. So people, be safe, be healthy, and take care.